Maternal and child care. Maternal and child care is the provision of medical, nutritional, and emotional support to women during pregnancy, childbirth, and the postnatal period, as well as care to infants and young children. This care is essential for the health and well-being of mothers and their children and encompasses a range of interventions and services, including 1. Antenatal care, regular checkups and screenings during pregnancy to monitor the health of the mother and fetus, manage any complications, and provide education and support to prepare for childbirth and care of the newborn. 2. Skilled attendance at birth, having trained healthcare professionals attend to the mother and infant during childbirth to ensure that any complications are identified and managed promptly. 3. Postnatal care, follow-up care for the mother and infant after childbirth to monitor their health, provide support for breastfeeding and nutrition, and manage any complications. 4. Immunizations, vaccinations to protect infants and young children against infectious diseases and prevent illness and deaths. 5. Family planning, access to contraception and family planning services to enable women and couples to plan and space their pregnancies optimally. 6. Nutrition, adequate and appropriate nutrition during pregnancy, lactation, and childhood to ensure healthy growth and development. Maternal and child care is crucial in reducing maternal and child mortality rates, improving the health and well-being of women and their children, and promoting economic growth and development. Antenatal care, prenatal care. Antenatal care, also known as prenatal care, is the medical care provided to pregnant women by healthcare professionals to monitor the health of the mother and fetus, prevent and identify any potential complications, and promote healthy pregnancy outcomes. Antenatal care typically involves a series of visits to a healthcare provider, starting early in pregnancy and continuing throughout the pregnancy to delivery. During antenatal care, the healthcare provider may perform a variety of assessments, which may include physical exams, blood and urine tests, ultrasounds, and monitoring of the fetal heart rate. Antenatal care also provides an opportunity for healthcare providers to offer education and support to the pregnant woman and her family, including information on healthy eating, exercise, and childbirth education. They may also provide counseling on choices for childbirth, and help with decisions regarding screening for abnormalities in the fetus. Antenatal care is important because it can help identify and manage potential complications, such as gestational diabetes, hypertension, or preterm labor, which can have significant negative impacts on both the mother and fetus. Regular antenatal care can lead to healthier pregnancies, with fewer complications, and may reduce the risks of maternal and infant mortality. The frequency and content of antenatal care may vary depending on individual needs, medical history and the stage of pregnancy. Pregnant women should consult with their healthcare provider to determine the best course of care during pregnancy. Postnatal care. Postnatal care is the medical care and support provided to a woman and her newborn baby after childbirth. This care is essential for ensuring the health and well-being of both the mother and the baby during the postpartum period, which can last up to 6 weeks after delivery. Postnatal care typically includes regular check-ins with a healthcare provider to monitor the recovery of the mother from childbirth, as well as the growth and development of the baby. During these visits, the healthcare provider may check vital signs, perform physical exams, and offer advice and support on a range of topics including breastfeeding, infant care, postpartum depression, and contraceptive use. Postnatal care is important for women because it can help detect and manage any complications that may arise after childbirth, such as infections, excessive bleeding, or postpartum depression. For newborn babies, postnatal care can help to identify and manage any health issues or developmental concerns that may arise in the first few weeks of life. Postnatal care may be provided by a variety of healthcare providers, including obstetricians, midwives, nurses, and pediatricians. The frequency and duration of postnatal care may vary depending on individual needs and the specific circumstances of the birth, such as whether or not the delivery was vaginal or cesarean. Postnatal care is an essential component of maternal and child health care, and can help reduce maternal and infant mortality rates, improve infant growth and development, and promote the overall health and well-being of families. Child health care. Child health care refers to the medical care and support provided to infants, children, and adolescents to promote their healthy growth and development. Child health care typically includes a range of services and interventions designed to prevent and treat illnesses and other health issues that may arise during childhood. Child health care may include regular checkups with a pediatrician or other health care provider to monitor growth and development, provide vaccinations and preventable disease screenings, and offer guidance and support on issues related to nutrition, sleep, exercise, and behavioral and developmental concerns. Child health care is important because it can help prevent and manage a wide range of health issues that may arise during childhood, such as infections, chronic illnesses, and developmental delays. Early detection and treatment of these issues can lead to better health outcomes and improved quality of life for children and their families. Child health care may also provide support and resources to parents and caregivers to help them promote the overall health and well-being of their children. This may include education and guidance on issues related to child safety, mental health, and healthy family dynamics. Child health care is typically provided by pediatricians, but may also include other healthcare professionals such as nurse practitioners, physician assistants, and family medicine doctors. The frequency and duration of child health care visits may vary depending on individual needs and the specific health concerns of the child. Overall, child health care is an essential component of health care for children, and can help promote healthy growth, prevent illness and disease, and improve the overall health and well-being of children and families. Advantages of breastfeeding over bottle feeding. Breastfeeding and bottle feeding are two options to feed infants, but breastfeeding has several advantages over bottle feeding. 1. Nutritional benefits. Breast milk is the perfect food for an infant, providing all the necessary nutrients, minerals, and vitamins that a baby needs for healthy growth and development. Breast milk also contains antibodies that can help protect the baby from infections and illnesses. 2. Reduced risk of infections. Infants who are breastfed have a lower risk of developing infections, such as ear infections, respiratory infections, and stomach infections, than those who are bottle-fed. 3. Promotes mother-infant bonding. Breastfeeding provides an opportunity for a mother to bond with her infant through skin-to-skin contact, eye contact, and other interactive behaviors. 4. Cost-effective. Breastfeeding is cost-effective as it requires no special equipment or formula preparations, unlike bottle feeding. 5. Convenience. Breast milk is always available, on demand, at the right temperature, and requires no preparation time or cleanup. 6. Environmental benefits. Breastfeeding is an environmentally friendly option as it does not produce any waste or packaging like bottle feeding does. 7. Lower risk of certain health conditions. Breastfeeding has been associated with a reduced risk of certain health conditions, such as obesity, type 2 diabetes, and asthma. Overall, breastfeeding has several advantages over bottle feeding for both the infant and mother. However, every family's situation is unique, and it is ultimately up to the parents to decide what feeding method is best for their child. Socio-cultural factors which affect maternal and child care in the family and community. There are several socio-cultural factors that can affect maternal and child care in the family and community, including 1. Cultural beliefs and practices. Cultural beliefs and traditions can impact the way a family takes care of a mother and child, such as beliefs about breastfeeding, birth practices, and traditional remedies for health issues. 2. Gender role expectations. Traditional gender roles can influence the division of labor and responsibility for maternal and child care, often placing the burden on women and limiting their mobility and autonomy. 3. Economic status. Low income and poverty can result in limited access to health care, adequate nutrition, and safe living conditions, all of which can affect maternal and child health and well-being. 4. Education and literacy. Low levels of education and literacy can contribute to low health literacy, limited access to healthcare resources and information, and poorer maternal and child health outcomes. 5. Access to healthcare services. Geographic location, cultural and language barriers, and financial resources can impact access to healthcare services, including prenatal care, delivery services, and postnatal care. 6. Family and social support. Social norms and support from family, friends, and community members can greatly impact a mother's ability to obtain necessary care, access resources, and make informed decisions about maternal and child health. 7. Political and legal factors. Policies and laws related to maternal and child health, such as maternity leave policies and child protection laws, can impact a family's ability to access necessary resources and services. Understanding socio-cultural factors that affect maternal and child care in the family and community can help healthcare providers and policymakers develop targeted interventions and support systems to improve maternal and child health outcomes. Maternal and child care for people living with HIV and AIDS, PLWHA. Maternal and child care for people living with HIV and AIDS, PLWHA, is important to ensure that both the mother and the child remain healthy and prevent transmission of the virus to the child. Here are some key considerations for maternal and child care for PLWHAs. 1. Antiretroviral therapy, ART. Pregnant women living with HIV should be placed on ART as early as possible and continue treatment throughout pregnancy and breastfeeding to prevent transmission of the virus to the child. 2. Prevention of mother-to-child transmission, PMTCT, services. In addition to ART, PMTCT services should include exclusive formula feeding, elective cesarean delivery for those who meet criteria, and appropriate follow-up to ensure the effectiveness of interventions. 3. Vaccinations. Children of HIV-infected mothers should receive all routine childhood vaccinations according to national guidelines, as well as any special vaccines recommended for children born to HIV-infected women. 4. Nutritional support. Nutritional support should be provided to both the mother and the child to improve maternal health during pregnancy and to support normal growth and development of the child. 5. Family planning. Family planning services should be offered to HIV-positive women to help them make informed decisions about future pregnancies and to prevent transmission of the virus to partners. 6. Psychosocial support. HIV-positive women and their families may need psychosocial support to cope with the challenges and stigma associated with HIV infection. 7. Routine HIV testing and counseling. Routine HIV testing and counseling should be available for pregnant women, their partners, and family members to ensure early identification of HIV infection and linkage to appropriate care and treatment services. Maternal and child care for PLWHAs requires a multidisciplinary and coordinated approach involving healthcare providers, social services, and community-based organizations to ensure that both the mother and child receive appropriate care and support. Revision exercise. 1. Why is it important to breastfeed the child after birth? 2. What is the role of prenatal care to pregnant women? 3. Outline socio-cultural factors that affect maternal and child care. 1. Breastfeeding is important after birth because breast milk contains essential nutrients and antibodies that help to protect the baby from infections and illnesses. Breastfeeding also promotes bonding between the mother and child, and can have long-term health benefits for both the mother and child. 2. Prenatal care plays a crucial role in ensuring the health and well-being of pregnant women and their unborn babies by monitoring for potential health risks or complications, providing education on healthy lifestyle choices, offering immunizations and screenings, and enabling early identification and treatment of any issues that may arise during pregnancy. 3. Socio-cultural factors can have a significant impact on maternal and child care. Some examples may include cultural beliefs and practices surrounding pregnancy and childbirth, such as traditional healing practices or beliefs about the role of women during pregnancy and childbirth. Religious beliefs or practices that may affect access to certain types of care or treatment. Language barriers or limited access to health care due to socioeconomic factors or lack of transportation. Stigma or discrimination related to HIV/AIDS or other health conditions, which may prevent individuals from seeking care or accessing necessary resources. Gender roles or expectations that may impact how men and women participate in maternal and child care, or access to education and resources related to these issues.